let's talk trigger finger. What a trigger finger is, normally it was noticed that those who use their gun shooting or triggers like this would frequently have overuse of the tendon that goes to that digit. When that tendon gets overused, the tendon will swell. Now, the way that our tendons work, you can't see them here obviously in this model, but I'm going to try to kind of picture it for you. A tendon is basically a rope that comes from your muscle way in your arm and goes right up against the bone, starting right here at that first knuckle there. And the tendon at that point is then cased and housed in a bunch of tunnels. And the tunnels keep it next to the bone, but the reason why is so that if we are bending our fingers, we don't have a tendon that goes from here to there. And then we wouldn't be able to use our hands. And so that pushes the tendon up against so that we can actually grab and grasp. The good thing about that is we have good mobility of our fingers. Our tendons, which insert all the way from here and go all the way to our forearm, can be able to bend every digit and give us that function we need. But the downside is if we overuse those tendons, that tunnel doesn't change. The tendon, if it swells, will be swollen up here, and then when we pull on that rope, it'll come through the end of the tunnel, and then if it's swollen, it gets stuck. And so patients will say that they have a trigger finger, and what happens is their finger gets stuck in this position and it stays there until you forcibly push or unlock it. Again, the cause being an overuse of the tendon to where it swells. And so the way that we help treat trigger finger is to find a way to reduce that tendon swelling. So the first thing is activity avoidance. I know that sounds like the funny papers in the newspaper that says, hey doc, this happens when I do this. Well, what's the doc going to say? Well, don't do that. And there's a little bit of truth to that in that when you're doing the activity, it's going to cause the tendon to swell. So if we can reduce it by bracing or just avoidance for a little bit, we get the tendon back to normal and then it can function again without having it get stuck. So bracing and activity avoidance is the first thing we talk about. Anti-inflammatories is another way where you can get your body to reduce the inflammation in general so that the inflammation in the tendon can also go down. If that doesn't work, we can always inject into the tendon right at the area where it gets stuck by the tunnel and see if we can reduce it with the steroid. A lot of times that helps, but it may not work with everybody. And so if you're having painful locking where it's getting stuck and you have to physically unlock it, a lot of times at that point, usually we'll talk about trigger finger release. And what the surgery is, it's pretty simple. We make a very small incision just right at that area, about the size of my pinky finger is about the size of the incision that we make. We go to both sides of the tendon and then we just release that first portion, that opening of the tunnel, because that's usually where the swelling is just at that first little tunnel. And if we can release that tunnel, at that point that tendon won't get stuck because there's no place for it to get stuck anymore. With the recovery being, the surgery itself takes about 10 minutes to do, and right away you're doing immediate range of motion so that we're not having any stiffness, because the biggest issue we have is stiffness with these or recurrence. The recurrence isn't as common. Stiffness is our biggest issue. Anytime we do surgery, the body's going to try to repair it and put scar tissue down. So our goal is to help tell your body, hey, you don't need as much scar tissue as you think. Get back to full motion so you don't have that locking right away. And again, that's the benefit, is immediately there's no locking anymore, but there's going to be some pain and some stiffness, and that's what we have to work past. With the goal to be to get you back to using your hand with all activities without restrictions, and you don't have that annoying locking anymore.